Hi, my name is TIESO-ECHEVARRIA, and today we're talking about how can we effectively treat metastatic cancer. 90% of cancer-related deaths are caused by metastasis, the silent spread of cancer from its arena site to distant organs, claiming life and leaving families shattered around the world. This reality impacts not only patients but also their families and communities, which is why understanding how to treat cancer, especially at its metastatic stage, is vital for you. As a biology student passionate about cancer research, I have studied how the tumor microenvironment influences cancer progression and how new strategies can make a real difference. Therefore, I want my audience to understand how to counteract metastatic cancer by examining the role of the tumor microenvironment and considering innovative therapy such as gene therapy and nanoparticles combined with immunotherapy. The first key aspect to discuss is the role of the tumor microenvironment, the true silent accomplice of cancer. The tumor microenvironment is the immediate environment where the tumor develops, composed of molecules and cells that can promote or limit the growth and spread of cancer. When you understand how changing the environment of the tumor can stop cancer from surviving and spreading, you realize why developing more effective treatments matters. There is a framework for a new multi-pronged therapeutic approach. This approach focuses on modifying both the primary and distant tumor microenvironment to make them less hospitable to cancer, while enhancing the immune response to achieve better outcomes. In modern therapy, the goal is not always to eliminate cancer completely, but to keep it stable and prevent its spread by targeting its microenvironment. Treatments like vascular normalization and immunotherapy help turn cancer into a manageable condition. Vascular normalization is a therapeutic strategy that aims to restore the normal structure and function of blood vessels within the tumor. Similarly, immunotherapy is a treatment that stimulates the body's immune system to recognize and attack cancer cells. The tumor microenvironment (TME) regulates essential tumor survival and promotion functions. Interactions between the cellular and structural components of the TME allow cancer cells to become invasive and disseminate from the primary site to distant locations. Through a complex and multi-step metastatic cascade, so targeting the TME is essential to prevent metastasis. Since DME is composed of many variables, there are several ways to treat the tumor microenvironment and prevent metastasis. Several treatments target components of the tumor microenvironment such as platelets and macrophages. Just as there in this new therapeutic approach directed at the environment, there are also innovative treatments that have proven effective and that are not strictly directed at the microenvironment. The second and final key aspect highlight innovative treatments such as gene therapy and nanoparticles combined with immunotherapy, which are revolutionizing the way metastatic cancer is tried today. By exploring innovative treatments like gene therapy and nanoparticles combined with immunotherapy, you understand how directing therapy selectively and enhance the immune response can offer more effective and safer options against metastatic cancer. Advances in cancer therapy need a novel therapeutic agent with novel mode of action, several mechanisms of cell death, and synergy with conventional managing. Gene therapy possesses all these profiles. Gene therapy introduces genetic material to stop cancer cell growth. For instance, Rexin the first targeted injectable vector for metastatic cancer, stopped tumor cells in their growth phase and induced cell deaths. Nanotechnology holds tremendous promise for improving immunotherapeutic outcomes in patients with metastatic cancer. In contrast to conventional cancer immunotherapies, rationally designed nanomaterials can trigger specific tumoricidal effects There being proven immune cell access to major sites of metastasis such as bone, lung, and lymph nodes, in optimizing antigen presentation and inducing a persistent immune response. Nanoimmunomodulators are specialized nanoparticles engineered to regulate or enhance the body immune response against cancer cells. Nanoimmunomodulators can not only effectively eliminate the primary tumor but also exhibit superior inhibitory effects on distal metastasis and prevent recurrence. Nanoparticles are extremely small particles, typically between 1 and 100 nanometer in size, designed to deliver drugs directed to target cells. Stimulus response nanoparticle SRNPS combined with immunotherapy offer the possibility to amplify anti-tumor immune response where the weak acidity, high concentration of glutathione, overexpression of enzyme, and reactive oxygen species and external stimuli in tumor act as triggers for controlled drug release. The design of SRNPS is based on the tumor microenvironment and/or external stimuli to combine with different anti-tumor drugs, especially the immunoregulatory agent, which eventually realize synergetic immunotherapy of malignant primary or metastatic tumor and acute or long-term immune memory to prevent tumor recurrence. Although these innovative treatments have marked significant progress in the treatment of metastatic cancer, we cannot ignore emerging approaches targeting the tumor microenvironment aimed at prevention and treatment. We now understand how science and research help us treat metastatic cancer. From understanding the role of the tumor microenvironment to applying innovative therapy such as gene therapy and nanoparticles combined with immunotherapy, we have clear tools to fight this disease. With this knowledge, we can move toward a future where fewer people suffer or lose their life to metastatic cancer. As Judy Wasser says, cancer is only going to be a chapter in your life, not the whole story. For any additional question on cancer regarding the prevention and treatment to counteract metastatic cancer, you may contact the Comprehensive Cancer Center. In this slide, you can see the website and the phone number. And this is my list of reference. Finally, thank you for your attention.